Welcome to AHP's virtual tour on how to generate reports using the AHP Performance Benchmarking Service. The tour's objectives are to help you understand how the metrics and reports are generated based on the survey data that you provided, and to review the reporting tools that are available. The key metrics that we use when running reports are net returns, which is a measure of bottom line fundraising revenues for the hospital or system. Cost to raise a dollar, which is a measure of your fundraising efficiency. Return on investment, which is a measure of your fundraising effectiveness. The metrics are calculated as follows. Cost to raise a dollar is calculated by taking your fundraising expenses and dividing it by your gross funds raised. Your fundraising expenses are calculated from sections B, C, and D of the survey, your direct and indirect human resources, and your operational or overhead expenses. Gross funds raised are pulled from section F of the survey, where you reported your cash and pledges. Return on investment is the inverse of cost to raise a dollar. It's gross funds raised divided by your fundraising expenses. Your net fundraising returns are calculated by taking gross funds raised for production and subtracting your fundraising expenses. All three metrics rely on the total fundraising expense value. That is calculated by taking your human resource expenses as reported in section B and C and adding it to your total operational expenses as reported in section D. If you'll recall, when you were completing sections B and C for your direct and indirect human resources, you provided compensation for each of your positions. We're taking the total compensation amount, subtracting any non-fundraising expense value, and using that as the total fundraising expense for your direct and indirect human resources. We then add that to the number reported for your overhead expenses. That provides us with a total fundraising expense number that can give us an overall metric for your cost to raise a dollar and your return on investment. We also provide metrics for each of your individual programs. So in order to generate your total expense number for major gifts, we then take the amount that you attributed to your major gift program, take that percentage from the total expense, and add those together for your direct, indirect, and operational. That way we can calculate your cost to raise a dollar and return on investment for each of your fundraising programs. Gross funds raised are pulled from section F of the survey where you reported your total cash and your total production. It's important to understand the definitions for total cash and total production. They're not mutually exclusive, so you can't add them together to get one value. They're meant to be examined separately. Total cash is outright gifts of cash made in any form, plus current year payments from previous year's pledges, planned gift maturities, bequests, and marketable securities. It provides a picture of cash on hand for immediate use by your healthcare hospital or system. Production represents all outright gifts of cash, excluding payments on pledges from previous years, and new gift commitments made in the reporting year. When generating reports in the database, the tools are located under the Benchmarking tab. Other reports and resources are located under the Downloads tab. In this tour, we're going to take a look at comparison groups, predefined reports, which include survey summary and your 5-year trends, report writer, and published reports. AHP publishes an overview report and a report that's become known as the High Performers Report each year. You will want to download tips in the user guide for step-by-step instructions on how to run these reports. Your survey summary report is simple to run. You choose the comparison group that you want to run your report on and the year. It will export the report to an Excel file with 7 tabs of data. Your board monitors, your management monitors for cash and production, your fundraising staff overview if you're permitted to view that data, your expenses, your average value of gifts, and your average value of gifts by source. If we take a look at the Board Monitors tab, you'll see that it provides you with the focus organization for this report, which is your organization, the year you chose to report on, and the comparison group that you used to report on. Your organization's data shows up in the first column, highlighted here in yellow. The metrics, cash return on investment, production return on investment, cost to raise $1, total cash, total production are here. And your comparison variables show up in the right in the aggregate. Your 5-year trends report runs the same way. You choose your comparison group in the year you want to report on. It'll generate an Excel file that shows over 5 years your total endowment, your total fundraising expenses, your return on investment, your cost to raise $1, and your net fundraising revenue. It'll provide your data shown here in the orange columns with an overlay of the trend lines above it. So you'll see the 25th percentile, the median, the average, and the 75th percentile for your comparisons. It'll also provide a table to show you the actual data. Report Writer is another tool available. Report Writer is different from the other 2 reports in that it allows you to choose every variable. It's customizable. So you then again choose the comparison group you want to use, the year, and then you choose each variable that you want in your report. Your data shows up here highlighted in the yellow, and the comparison is below it. And the variables chosen show up in the various columns. All of the reports allow you to choose a comparison group. This is where you choose your peer group that you want to compare yourself to in the different reports. You're allowed to create as many comparison groups as you need. AHP recommends that you start large and compare yourself to everyone in the database, and then start to create various groups based on your need and make them smaller and smaller. For example, if you're a community hospital, you may want to create a comparison group that only includes community hospitals. You choose the variables. It could be community hospitals, number of staff beds, number of FTEs, and create your groups. It saves your groups, and then when you want to run a report, you choose the group that you want to use. It also has the ability for you to create a new group from scratch. So it'll list the organizations in the database, and then you can pick and choose who you would like in your group. Things to look for when you're running reports are the number of FTEs and their compensation, the total fundraising expenses, and the number of programs and the program emphasis for each of the programs. If you review the overview report and AHP's high performers report, you'll find time and time again that the biggest indicator of success in terms of net fundraising revenue is the fundraising expense budget. So pay particular attention to those numbers when you're running your comparisons.